and Brad, the two most famous physical therapists on the internet.
Hi, I'm Bob Schrupp, physical therapist.
And I'm Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course.
He's on a higher stool than I am, just in case you're wondering. Okay, today, Brad, we're going to talk about how to stretch your hand after you've maybe had a wrist fracture and it's tightened up on you, and you have a contracture and now you want to get it back to normal, right?
Right. So you've had the fracture in the wrist and you've had it casted probably for 4 to 6 weeks, and after you take the cast off, if you've had this or you're going through this, you know it's like you can't do this. It's stiff, and sometimes it gets what we call contractured, where things are just tightened up, and it takes a number of days and weeks sometimes to get that hand to open
Get back
up.
to where it was.
So if you're in that situation right now, this is the way I treat my patients with this, and it works quite well, is I'll have them go finger at a time. Instead of trying to stretch the whole hand, one finger at a time.
For the stretch.
Right, versus 4 tendons, you're doing one. And I just take your good hand and I tell them, just work it, sometimes just one joint at a time. Or
I'll go from the side.
Yep. And I'll work it there. So we're just trying to straighten that finger out. And sometimes I'll work the end, and it kind of depends on the person, or we'll work up into this joint. And it really depends, it varies person to person, but it's one finger at a time.
One thing that you're doing automatically, Brad, without even thinking about it, is you're putting your hand on the joint and then pulling up. See, there's 3 joints here.
Right.
So you put his hand pulled up,
Sure.
hand pulled up, hand pulled up.
Yep. Yep.
So
And if you're contracted, you won't be able to do that. But as it gets better, that's when that concept, you get a leverage in there, it comes on better. You may just end up going like this at first, and as it works. And do one finger at a time.
Yep, one finger at a time.
Yep. And all the way to the pinky finger. And once you get all the fingers starting to loosen up, and one thing that works good for this, Bob, too, is I'll say, try and wash the dishes, but no knives. Just the warm water,
Sure.
Put it in warm water.
You're getting movement and you got warmth.
Yep, you got the warmth in there. A hot pack can work before, assuming there's no swelling and redness already. And then, once the fingers start to open up, then we'll go into this, where you take the other hand, and I call this the spider on the mirror effect, because if you ever have a spider on the mirror,
Sure.
There we go. We got the.
Did you come up with that term?
No, a patient did.
Oh.
I'm not that
It's a
creative.
great one. That's a cool.
Yeah, so you finger to finger, and then you try and work and stretch.
Spider on the mirror.
Yep, and stretch it like that. And you get a little weight bearing, so there's a little bit of strength. Not really, but in theory, you could do that for a classroom test.
I like this technique. That's a great one.
Or sometimes I'll have them go like this and just do this, because the wrist will be tight too.
Sure.
Once you get to the fingers and the wrist is tight, then that thumb here and stretch up here, and look at my elbows are down.
You bring it up like this.
Elbows up works the wrist and the fingers. The whole goal is to get the hands flat and elbows up, like
Sure.
maybe praying or something of that nature, okay? Now, one thing that works nice is to get some weight bearing through this is an option when it's starting to open up. Put your hand on the table and make sure you got a cloth so it slides.
Are you catching this, Lonnie, or do you want to get closer?
I'll do it from this angle right here. So here we have a little bit of contraction. The fingers are tight. I'm going to take my good hand right over the top, and I'm just going to push them down. This may hurt a little bit. If it's really sharp pain, you're going too hard, you're not ready for it yet.
Right.
But it should be some stretching, maybe a stretch pain, and that's it. Stretch, hold, and then I'm going to lean forward, get my tie out of the way, and then I'm going to stretch that wrist out as well.
Now, I don't know that I would do this if you had a fracture or pins put in the hand.
Right.
This is more if you broke the wrist and the hand got tight as a secondary response.
Right. The doctor has already mentioned, and maybe we should mention this right away, activity as tolerated.
Right.
As long as it's not painful, you can go ahead and
The
do
doctor
that.
has ordered it that way, that you can, whatever you can tolerate.
Right. That's a good point, Bob.
So, yeah, it's a good exercise, leaning on it like that.
Right.
So,
Using your own body weight with a little gravity. Yeah.
All
So
right.
anything, what say you, Bob?
I say thanks for watching, and please subscribe if you haven't already.
All right. Hold on. I want to do this.
All right, that was funny.